The great fear is if we don't get our response to coronavirus right, Australia could experience the hell Italy is currently enduring. With around 50,000 confirmed cases and more deaths than any other country, including China, Italy's health system simply can't cope. The Italian poet Dante described 9 circles of hell, each worse than the last. Today, Italy is living through them.
You don't know what's going to happen tomorrow and the day after, but you know that it's going to be worse than the day before.
Our cameras are allowed access to the very front line of the coronavirus catastrophe. This is the nightmare facing our health system if the pandemic takes hold.
If what happens here in Lombardy spreads to the entire world with the same speed and the same violence, we can expect more deaths than during the Second World War.
Professor Giacomo Grasselli is an intensive care specialist, coordinating all the ICU units in hospitals across Lombardy, ground zero of Italy's exponential outbreak.
I think that here in Lombardy we had something similar to what happened in Wuhan, and that it was just the explosion of a bomb. And then from there on, the disease spread very quickly, and if it happens like that, it's impossible to stop. It's an incredible number. They are like the tip of an iceberg.
It sounds like a living hell when you walk through your intensive care units. I mean, how are you feeling?
Well, you know, it's an incredible stress for the healthcare system. And believe me, the healthcare system here in Lombardy is quite well organized. I mean, Lombardy is a very rich region. But still, despite all this, if the disease keeps spreading with this speed, we will get to a point where the number of beds in the ICU will not be enough for the number of patients requiring ICU admission. So, and we and you absolutely have to avoid to get to that point, because otherwise we will certainly get to a point where people will die at home because we will never be able to help them.
4 weeks ago, the state of Lombardy had 750 ICU beds, comparable with most Western countries. Now they have upwards of 3,000 coronavirus patients needing those beds. It's a medical war zone.
Tutti i sistemi di protezione individuali, dispositivi di protezione individuale, quindi il camice, i calzari, la cuffia, i guanti che sono da cambiare rispetto a quelli che addosso, la mascherina chirurgica, gli occhiali protettivi.
Carla Mastrini is the intensive care coordinator at Cremona Hospital. Coronavirus patients are placed on their fronts while being ventilated, so gravity helps the oxygen get into their bloodstream. It's medical protocol for patients with acute pneumonia, but it's not working, and the staff don't know why.
Purtroppo qua da noi non abbiamo ancora visto nessuno risvegliarsi. Noi abbiamo bisogno di togliere il tubo a qualcuno e di vedere che qualcuno sta meglio, perché altrimenti non riusciamo ad andare avanti. Abbiamo bisogno di qualcosa che ci faccia capire che quello che stiamo facendo serve.
Australia is only weeks behind Italy on the pandemic timeline, but Professor Grasselli warns the difference between control and calamity can be days, if not hours.
Most of the countries in the world, in Australia, maybe still in the United States, Northern Europe, you are still in a phase where probably the virus is around, is infected people, but the bomb has not exploded yet. So you are probably in the first phase before the bomb explodes.
And it is a bomb.
Yeah, in some way it's worse than a bomb, because you don't know what's going to happen tomorrow and the day after, and you know it, but you know that it's going to be worse than the day before.
Even though Italy is totally locked down, Professor Grasselli worries that Italians are still tempted to break their home isolation, and that would be devastating.
Now spring is coming here. The weather is beautiful, temperature is nice, so people want to go around. It's normal after winter, but they have to understand that it's like a collective suicide.
In Cremona Hospital alone, of the 1,000 people admitted, more than 100 have died.
Tanti decessi. E questo ci fa morire perché pensiamo di non riuscire a fare quello che siamo qua per fare, curare la gente e farla star meglio. E in realtà noi la vediamo morire, questo ci fa morire anche noi.
The ultimate horror will come to Italy if coronavirus hits the country's largest northern city, Milan.
Dico che noi siamo impotenti davanti a questa situazione.
Cremona Hospital intensive care nurse Simona Tomasoni.
È vero, noi siamo operatori abituati ad avere pazienti gravi, in fin di vita, ci crediamo molto, ma questo susseguirsi così repentino di pazienti in pericolo di vita non siamo abituati nemmeno noi. È dura per tutti.
Are you at a point where you're having to decide in the worst possible way who lives and who dies?
We are not at that point yet, but I want to warn everyone that if we don't stop this, not only here in Lombardy, but in the nearby Italian regions, in Europe and in the world, we will all have to make those decisions. Because the load of patients on the healthcare system is so huge that no healthcare system, again, no matter how potent, powerful, modern it is, can sustain it. Since the number of carriers is so huge, then those absolute numbers become impossible to sustain.
Remember, this is an advanced Western country just like Australia, now frantically building temporary intensive care units in hospital grounds. And in all hospitals, including Cremona, new ICU beds are being rushed in to try and cope with the epidemic.
Sente questo rumore?
Come?
Il rumore.
Sì, cos'è?
È l'ossigeno.
40 anni che faccio il medico e non ho mai visto una cosa del genere.
Head of pulmonology at Cremona, Giancarlo Bossio, is getting by on a few hours sleep a night fighting this war. He says while the elderly have been dying in their hundreds, more and more young people are succumbing to the virus.
Purtroppo c'è una mortalità significativa. Colpisce purtroppo, ahimè, solo le persone anziane. Abbiamo avuto anche un 23enne.
The toll on health workers here, now in their fourth week of this terrible battle against an invisible enemy, is crushing.
A casa ci vado qualche ora di sera, dove muoio sul divano e sprofondo in un sonno che non è sonno perché mi sveglio ogni ora con gli incubi. Mi aspettano mio marito e mia figlia che mi parlano e io non li ascolto. Loro mi chiedono se li sto ascoltando, ma io non li sento. Ed è terribile.
Professor, how do you see this ending?
Well, I'm sure that this will end. This will certainly end with the vaccination, and I'm sure that now no vax people will take the shot anyway. But it will end with many deaths, and I think that the world will never be the same, will not be the same after this. The world will change. Healthcare systems will change after this. Hospitals will change, because we're certainly going to have new pandemics. This is not the only one we will see in our life, and that will be the biggest lesson we will learn from this nightmare which is happening here.
Hello, I'm Tara Brown. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.